Good evening, everyone, and thank you for joining us for this awesome panel discussion that we have for you this evening. As you can see from the screen, we have phenomenal group of physicians here in Maryland, starting with Dr. Kathryn Kelly, Dr. George Bone, Dr. Ben Stallings, and Dr. Renee Bovelle, and Dr. Keya as our moderator. My name is Allan Browder, and I've been the executive director for the Center for Healthy Maryland for a little over a year and a half. And we've been wanting to do an initiative like this for a long time, and so it's long overdue that we start the conversation regarding race and gender and ethnicity in healthcare. So we're very excited for you to be with us this evening. But in a nutshell, MedChi is the only society that represents all physicians in Maryland. It is a statewide medical association for all licensed medical doctors and doctors of osteopathy. They are here. We are here. MedChi in general is here to advocate for you as a physician, to be your resource when it comes to anything, whether it's continuing education or connecting members with other members of their societies. And we're also doctors. You know, it's completely made up of physicians. So everything that's important to you, whether it's a private practice or a hospital, is important to us. So if you aren't a member and you're out there and want to be a member of MedChi, please take a look at the website, medchi.org, and become a member or give us a call, and we'd love to walk you through how membership works. MedChi started in 1799, so it's been around for 226 years now. But as of 1983 was the first Black president. That was Dr. Roland Smoot. Over the course of the last 25 years, there's been extreme progress when it comes to diversity, both in race and gender. Dr. Kathryn Smoot Hasselness, in 2002, was our first women MedChi president. Dr. Edwards following in 2004. Our panel members, Dr. George Bone and Dr. Stallings in 2005, and then 2018. A lot of other physicians, both of different ethnicities, a lot of other women, a lot of other men that all encompass what we are, what MedChi is, which is, you know, who our patients are. You know, we are representative of the community that we serve, and we hope to continue to be that. So the center is the nonprofit foundation of the Maryland State Medical Society, which is MedChi. We were established in 1976, so we're going on our 50 years next year. Stay tuned for another panel discussion then. Along with multiple other in the next 6 months, in the next year. We're going to keep this conversation going. But our main goal is to advance the practice of medicine, enhance the quality of medical care, and promote the health of citizens in Maryland. And so we're excited because this evening we have a new initiative that we're hoping helps the next generation of students find a path to a successful healthcare career. So this is just an overview of what the center does, the 3 different programs that we do have. The first being the Maryland Physician Health Program, which is what the MedChi Foundation at the time, and now the center started with, that helps provide physicians with the help they need from any number of things, whether it's burnout, stress, mental health, substance abuse. We call us the healers, I would say. We are the ones helping doctors. The Maryland Healthcare Coalition for Domestic Violence Prevention, that's us. You just heard from Lauren. Lauren is a part of that program along with Audrey Bergen. They help train doctors around the state of Maryland on what questions to ask of their patients to discover whether or not there are any forms of IPV or intimate partner violence or domestic violence in the homes. And then the newest program, the Bridge the Gap program, which I alluded to earlier, is a program that's addressed at reducing the risk of shortage of physicians in the healthcare workforce. It's going to expand on opportunities for all docs from all backgrounds, marginalized communities, kids that don't necessarily have an option or have the ability to be exposed to a physician in the house or a nurse in the house. We're trying to provide that exposure for them to allow them to have a successful career in healthcare. Touching on that, there's some stats. We'd love to build a more inclusive healthcare system. By doing that, I think it's imperative that we have a community that looks like our patients. So just in Baltimore, I know people are watching from around the country, and this is, you know, probably subject to some of your areas where you live. but having more representation when it comes to going to the doctor's office. If 60% of the population in Baltimore identify as Black or African American, and less than 5% of those physicians are Black or African American, it doesn't necessarily do any help towards the patient outcomes. So we're trying to get a more inclusive healthcare system with representation from the people that are seen. Increase the overall number of students is the goal of Bridge the Gap. Like I said, by 2036, there's an expected shortage of a little under 100,000, 86,000 physicians to exit healthcare. So we're trying to increase the number of students entering medical school to address this shortage. And then exposure. Exposure is number one. Basically, giving kids who might not see themselves like these amazing docs that you see on the screen, giving them, exposing them to the fact that they can be a physician. They can work in healthcare. Just because they don't see people that look like them when they go to the regular checkup or a doctor's, appointment, that doesn't mean that they can't be one. So we're working with area hospitals. We're working with area schools. There's 72 hospitals just alone in the greater Baltimore area. We are going to try to work with every single one of them to give the kids in our program exposure to the tools they need. And then foster. We've got MedChi has a little under 10,000 physicians in the MedChi membership who can help mentor the next generation of kids from every specialty. So we almost have a responsibility to be able to have a pipeline for medical professionals that allow the next generation to become physicians or even just healthcare providers. So now I get to start the panel discussion, which goes to the smarter people on the screen. So beginning with Dr. Tsao, it's my honor and privilege to announce her as our moderator for this evening. Dr. Tsao is a distinguished physician scientist with a notable career in vaccine development and public health policy. She graduated from the University of Maryland and conducted research at Walter Reed, and she played a key role in developing the 2005 pandemic flu plan for the Health and Human Services and served as an information officer during the SARS pandemic. Along with all of her accolades, I think my biggest thing, and I'm going to go off the cuff here, Dr. Tsao, I'm sorry, because we've had phenomenal conversations over the past few weeks, and I've had great conversations with every panel member, so I'm very excited about this evening. But along with all of her accomplishments, it's her wanting to bring the next generation up, her wanting to bring the next generation of, whether it's women, whether it's people of color, whether it's people that are not, don't have the ability to see themselves as a doctor. She has developed and been a part of many successful programs over her incredible career that has provided advocacy for equal opportunity and minority representation in medicine.
Thank you, Allan Browder, for that wonderful introduction. We are here for our Empowering Excellence panel discussion, where we have wonderful panelists, Dr. Bovelle, Dr. Stallings, Dr. Bone, and Dr. Kelly. Dr. Renee Bovelle. Dr. Renee Bovelle, MD, is the owner and medical director of Advanced Eye Care Medical Center, DBA, and Vision Eye and Laser. Dr. Bovelle is a board-certified ophthalmologist trained at Wesley College, UCLA School of Medicine, Yale University, and the LSU Eye Center. She was pleased to be named a Washingtonian top doctor by her peers. Additionally, she received a master's in cybersecurity strategy and information management from GW University and focused on policies and practice that protect critical information with particular attention to the healthcare field. She has academic appointments at Howard University Hospital, Ross University Hospital, Ross University School of Medicine, and the University of Maryland Capital Regional Medical Center. She's been privileged to educate and mentor pre-med medical students, residents, and physicians locally, nationally, and internationally on a broad array of issues in ophthalmology and cyber technologies. She authored the first MedChi-approved continuing medical education course on cybersecurity for physicians and continues to work for both national and regional medical organizations. She's enlightened people on the importance of eye health via webinars and health fairs in PG County, regionally, and internationally. Additionally, she authored a chapter in Navigating a Triple Pandemic, Volume 3, Claiming Our Healing and Embracing Our New Normal. She holds national and local leadership positions in ophthalmic and other medical associations. She's president-elect of the Ophthalmic World Leaders. She's honored to serve on the American Academy of Ophthalmology committees on medical information, technology, state affairs, and OPTPAC. She also served as a Cornea Symposium moderator for 2023 and 2024 of the National Medical Association meeting. She's an active board member in several organizations, including the Maryland Society of Eye Physicians and Surgeons, National Caucus and Center on Black Aging, MedChi, the Maryland State Medical Association. Under Dr. Bovelle's leadership as MSEPS president, the organization received the 2021 Star Award for Innovative Delivery of Education and Value to Society members. Most recently, she was honored by being inducted into the 2023 class of Enterprising Women of the Year and 2024 Castle Connolly Top Doctor. Our next panelist is Dr. Benjamin Zion Stallings. He's a distinguished board-certified radiologist with over 30 years of service to the medical community. A native of Petersburg, Virginia, he pursued his undergraduate studies at Virginia Tech before in earning a medical degree from the Medical College of Virginia. He completed his internship at the University of Maryland, followed by residency in radiology at the Medical Center of Delaware. Dr. Stallings served as director of the Department of Imaging at Doctors Community Hospital for more than 3 decades. He was also the president and CEO of Diagnostic Imaging Associates and Diagnostic Imaging. Actively engaged in professional organizations, he's a member of the AMA, the National Medical Association, the American College of Radiology, the Radiologic Society of North America, and Maryland State Medical Society. Throughout his career, Dr. Stallings has held numerous leadership positions, including serving as the president of the Maryland State Medical Society from 2018 to 19. He currently serves as chairman of the Unity Insurance Board and is the medical director for the Department of Imaging at Holy Cross Hospitals. Next, we have Dr. Bone. Dr. George Bone is dedicated to delivering trustworthy healthcare, aiming to reduce costs and enhance electronic medical services. His background in chemical engineering at the University of Minnesota, medical training at St. Louis University School of Medicine, and NIH Research Fellowship honed his medical problem-solving expertise. As a full-time internal medicine attending physician at IC Care, Inc., and healthcare technology consultant on Salesforce Health Cloud, he addresses complex medical issues preventing wellness and seeks to promote longevity. Over 4 decades, he's led physician independent practice associations, accountable care organizations, medical societies, served on hospital boards, state task forces on health, and contributed to healthcare innovation and software solutions. In summary, his lifelong education, diverse expertise, and leadership drive cost-effective, trustworthy healthcare for all. And finally, our final panelist, Dr. Kathryn Kelly is a board-certified internal medicine physician in Silver Spring, Maryland. She's originally from Tampa, Florida, a 2-time Howard University graduate, a laureate scholar, completing her undergraduate studies in 2001 with a Bachelor of Science in Biology and a Bachelor of Arts in Anthropology. She completed her medical degree in 2007 while serving as the president of the medical school. She completed her internal medicine residency at Washington Hospital Center and did an additional year as one of 3 chief residents from 2007 to 2011. Dr. Kelly, who was a National Health Service Corps scholar during medical school, fulfilled her service obligation in Albany, Georgia before returning to the DC area. She's the owner and CEO of Kelly Collaborative Medicine, focusing on patient-centered primary care since 2016. Additionally, Kelly Collaborative Medicine is contracted through Montgomery County to provide primary care to individuals experiencing homelessness at numerous shelters, street homelessness, and outreach efforts in the Montgomery County. She sits on the board of directors for Girls Health Ed, serving as interim board chair, an international nonprofit organization committed to fostering a world where girls can make informed decisions about their bodies and health. She's immediate past president for the Howard University Medical Alumni Association Executive Board, having served from 2021 to 2024. She also serves as commission on the Montgomery County Interagency Commission on Homelessness and represents the Montgomery Cares Advisory Board for the Montgomery County Medical Society, currently serving as chair, and secretary for the MCMS, where she continues advocating for both physicians and patients. She created KCM Private Practice Solutions in 2022 to help physicians start solo practices and offers consultation and guidance in the process based on her own journey in private practice. In 2024, she incorporated KCM Cares, a nonprofit focused on serving our most vulnerable populations, to further her mission on healthcare equity and access. She's married to Jackie Matthew Kelly and has 3 children, Aja, Jackson, Reagan, and granddaughter Nyla. So now I'm going to go back to the slides for our questions. So I'm going to ask each panelist, and if you could please answer in the order I've introduced you. When did you decide you wanted a career in medicine, and what challenges did you face, and what made you think that you could succeed? So, Dr. Bovelle, we will start with you.
Okay, I decided when I was in elementary school that I wanted to become a doctor. In those days, a while ago, people would say, "What do you want to be when you grow up?" And I liked watching TV, and I'll tell you, I wanted to be uh, like Julia, that girl, and Emergency. Somebody asked me, and I said I wanted to be a paramedic. And I remember the lady told me, "You should become a doctor because a doctor is at the top. The doctor helps the paramedics, and you can decide how to help people more." So then I just said, okay, that's what I'll do. In elementary school, I liked science. I remember learning about the heart, and all throughout my education, I held steadfast to that. Now, as I progressed in education, first, I think people thought that it was cute. And I'm talking about the wider majority. I remember when I went to college, a few people said, "Oh, you got into this college because of affirmative action." And then as I kept going up, there were more and more barriers, kind of disparaging remarks and things like that. But I held true and steadfast to what I wanted to do. And I worked very hard. And I basically told men, women, and children that's what I wanted to do, whoever would listen. And I was happy to have a good support system.
Next, we'll ask the same question to you, Dr. Stallings.
When I was a sophomore in college, I met someone who was a man sitting on the steps between the gym and one of our academic buildings. Then this grown man was crying, and I was asking why he was crying, and he said because it wasn't fair that Blacks couldn't get into medicine. And we had this long discussion about the barriers and how difficult it was for minorities to become physicians. And at that time, I decided that's what I'll do. I'll just, since it's so hard, I'll go into medicine. The question that you asked, and you alluded to it in many of your comments, some of the barriers in going into medicine, and you were spot on. It's money. I was from an extremely, there's rich, upper class, upper middle class, lower middle class, and then poor. I was under that. We had no money, no resources, nothing. And that becomes difficult when you come from a family, when you have kids who are going to, and mostly white counterparts back then. Again, I finished a long time ago. When they go to medical school, the parents are physicians or lawyers, and they can afford to buy them cars and pay their rent and give them money. They can still travel and enjoy themselves. When you come from a family with no means, your friends are graduating from college. They are buying cars and going out on their own, and you're not only not generating revenue, you're paying high tuition to go to medical school. So you're borrowing money, not making any money, while everyone else is enjoying their life. You're still, trying to develop a career. So that's one of the huge barriers. And I guess in that situation, though, you have to, how do you succeed in there? You just have to believe in yourself and decide that you're just going to overcome and grind it out. But again, my decision was kind of late in my college career, and the biggest barrier that I think many minorities, probably similar to myself, it's the monetary aspect of it. It's a very long path to travel with no money, and you have so many others who have unlimited resources to go to medical school.
We'll go on to you, Dr. Thank you, Dr. Stallings. So when did you decide that you wanted to go into medicine, and what were your challenges, and what made you think you could succeed?
I decided somewhere when I was maybe 14. My favorite dog died and it hurt me. And I said to myself, this is not good. And I remember committing to myself that I would either be a chemical engineer or a physician. And I would definitely not be a biologist. So I went to chemical engineering school. No one believed me that I would be a physician. I just told them that that's what I'll do. Finished chemical engineering when I was 20 years old, and got married. Showed up in medical school with a kid, a stay-at-home wife, and promised scholarship money didn't show up. So one of the things that kept me going was the guy who interviewed me, Dr. Longmire, may God rest his soul. He was a biochemist. He told me, Bone, just know that all systems are made up of people. People make rules and people can change rules. So don't ever be afraid of rules. So I worked full-time for the first 2 years in medical school. I got a job as a chemical engineer. And so I would work in Krung-Zellerbach ink factory in St. Louis, 8 hours every day. Go home, do my homework, show up, and do it all over again. For 2 years, not knowing what I'll do when my clerkship would begin in my junior year. And money that was not available all of a sudden showed up. And by the way, I had a second child. So I had a wife and 2 kids. And knowing that systems will bend to people, and the miracle of life is that it happens. And irrespective of how formidable the odds might seem, faith and looking around and pursuing the reality that you know you can create works miracles. And it's not until you rap at the door you realize that the door can open, even though it might appear to be a solid concrete wall. So it's trials and tribulations exist, but faith and will is a remarkable tool that will always work. That's my story.
Thank you, Dr. Bo. And I'm going to address Dr. Kelly with the same question. When did you decide you wanted to go into medicine, and what were some of the barriers and how did you overcome them?
It's going last is you hear yourself in everyone's story. I never wanted to be anything other than a physician. I remember somebody asked me, and I wanted to initially be a pediatric cardiologist and neurologist. I didn't realize how much training went into actually doing that. And I was good at school. My family, like Dr. Stallings, was also impoverished and grew up with a lot of, not in my immediate family, but drugs was a big part of the 80s in Florida. So watching people do drugs and watching, family members fall under that unfortunate pressure of drug use. And then I had my own setback. So I was a teen parent. I had my first daughter when I was 15 years old. So, I'm very blessed. My mom never once told me I still couldn't be a doctor. She never let the naysayers get to me. A lot of people had a lot of things to say. I got a full academic scholarship at Howard University. So I went to Howard University as a part of the BSMD program. And I think the unique thing about going to Howard at that point was that I had been the only Black student in a lot of my classes. Like I was the smart Black kid, but at Howard, everybody's a smart Black kid, right? Or a smart person of color. So then you had the opportunity to form your identity as who you really are. I was a band nerd. I met my husband in the band at Howard, found my clique, and was able to kind of formulate myself and my identity and my confidence at Howard University among people that looked like me, and never once really questioning that I could do it or not, because I saw people around me actually doing it. Like growing up, the only Black doctor I'd ever seen was Heathcliff Huxtable on The Cosby Show. None of my doctors in my life or none of the people that I saw on TV looked like me. I didn't go into the BSMD program because this goes into the financial part. I wouldn't have been able to keep my academic scholarship. At that time, they weren't allowing BSMD students to use their scholarships for medical school. So I doubled my major, and I doubled in medical anthropology. And I actually wanted to do a MD, PhD in medical anthropology, but somebody didn't write my letter. So I went and actually taught high school for 2 years before I went back to medical school. Before returning to Howard University. And the story behind teaching is that I taught in New York City, and 9/11 happened my first 2 weeks of teaching. So the weekend before 9/11, I actually had been at Ground Zero. And one of the projects I worked on at Howard, the African Burial Ground Project, actually is in that region and was affected by the towers actually falling. But at some point I was doing good at teaching, and I enjoyed teaching. I taught high school chemistry, physics, and earth science for 2 years in New York City, but I knew I wanted to go back and be a doctor. My daughter was about 8 or 9 at the time. And I moved back to the DC area to go to Howard for medical school. And thankfully, my mom kept my daughter throughout undergrad. So for 4 years, I was able to focus and actually go to school and focus. And my husband, we got married during medical school. He actually helped me with my daughter while I was in medical school. I worked, I waited tables all through medical school, would go and wait tables during the day and then go at night and study, right before the test and cram it in. And then I got pregnant my last year in medical school. So I started residency. I had my son 6 weeks into residency. So the children always kind of, like, I agree, life happens when it happens, and you have to kind of negotiate around that. And I'm very blessed that I have a village of people who believed in me and supported me. And I think it's not just because they saw potential, but because I put the effort in and worked hard, and was grateful and went back and did the things that I said I was going to do.
Thank you very much, Dr. Kelly. As you can see, a lot of us have had different pathways toward medicine, and we've handled the challenges in different ways. The next two questions are, what challenges did you face in your journey to and through medical school, and how did you overcome them? And what obstacles have you faced as a physician, and have you navigated them? I'm going to go and start with Dr. Bovelle.
Okay. Yes, I remember in histology lab, we had to buy a microscope, and then you look at the slides, and well, I wasn't able to buy a microscope. So for those who couldn't afford the microscope, they had microscopes that you could rent. So, and those microscopes weren't as good. Everything looked yellow. The light was very dim. I tried to get a new bulb. They said that was the brightest for that type of microscope. So when all the other people were seeing the rosettes and this is this color and that's blue, everything to me looked kind of a yellow or amber color. So that made learning histology a little more difficult. I also took a year between college and medical school, and I worked at NIH for a year. Sounds like it's good, but when you go back to studying, you really have to learn how to study science, and you have to be able to figure out what's important, what they're going to test you on. And initially, that was a little bit difficult for me because I didn't major in the sciences. I took the science courses I needed to for the MCAT. I majored in Black studies and psychology because that's what I enjoyed. So my advice would be to learn how to study, practice it now. Don't think that just because you go to medical school, it's automatically going to turn on. I remember seeing the Black students, not as many of us graduated on time within 4 years. Some had to take time off for various reasons. Other ones were asked to leave. Where I went to medical school, a C could be a C, and that could be a passing grade, or a C could be an F. How could a C be an F? Well, if you had a C in a course and they felt that you really didn't try enough, or you weren't comporting yourself in a professional manner, and you had too many C's, they could ask you to leave. So I did start to see, even in medical school, once you get in, it's still hard to stay in and graduate. And the same thing in residency. Residency was very, very hard.
Thank you, Dr. Bovelle. Now, Dr. Stallings.
Just everyone seems to have a common theme with regards to poverty. So I hope that the listeners understand, as being a minority, you don't have the same resources that everyone else has. Everyone, when you end up at medical school, we have to realize in that climate, the teachers and your colleagues are going to have stereotypes of Blacks. There's no way around that. They're going to see you, and particularly if you go to a medical school that's predominantly white, they're going to see you as they see you. And I'll just tell a quick story. During my third year of medical school, I took a rotation. I did my rotation in pediatrics, and I was called to the dean of pediatrics office, and I was wondering why. It was at the end of the pediatric rotation, and the dean said, "There's a discrepancy in your grades at this medical school. There's honors, below honors is high pass, below high pass is pass, and then there's fail." He said, "Well, on the two exams, you got honors. On the two rotations, there were 3 rotations, but on 2 rotations, you received the honors in one, and you received a high pass in the other. But on the third rotation, on a scale of 1 to 10, a 6 is failing, and you received a 2. And he said, to your advantage, your other grades are so high, we realize there's a discrepancy." And I told him, this particular resident is known to be racist. How are you going to get honors, high pass, and that 5th grade is a 2 out of 10. So needless to say, they understood and gave me the grade that I was supposed to get. They just excluded her grade. And what I continued to think during this time period is, had I been a marginal student, a student that was just getting passing grades, that too would have forced me, because if you fail any of your rotations, you have to complete the entire year of rotations again. So you place your career in the hands of someone who doesn't like you. It's dangerous. And the only way to succeed in that environment, as our moderator did throughout her medical school, is to try to stay at the top of your class. If you stay at the top of your class, you kind of prevent any sort of racism or them trying to destroy your career. So it's very important to listeners who may be interested in going to medical school, to whatever you do, whether it's college or high school, try to stay at the top end of your class, because there are people that you can't see that are trying to take you out.
Thank you, Dr. Stallings. I actually had a similar situation. I was taking graduate classes on medical school, and the academic director called me in to say, "You're not evolved enough," meaning my race is not evolved enough to be in higher education, so he's going to fail me out. And like you, I said to him, "You go ahead and try. Not only have I outperformed your students, but I teach many of your students. So if you do that, there is no judge in the country who's going to believe that I failed out." But if I had not been getting A's and had not been known to be teaching other students, I would have lost my opportunities and I'd have been kicked out of school. Okay, now, Dr. Bone, we'd love to hear from you.
The biggest drama in medical school was my undergraduate medical school in neuroscience. Neuroscience was supposed to be the toughest course in the second year. And it would begin at 1 o'clock to go until 4, and I would have to leave at 3 o'clock to go to work. And there would always have to be X number of students that had to flunk that class. I was flunked by 3 points, and which almost ended my medical career. Luckily, on the standardized part 2 of the boards, part 1 of the boards, I passed with flying colors. So what was to be done with 8 of us that allegedly flunked neuroscience, of which there were 4 persons of color and 2 women. Luckily, all of us passed the repeat course with flying colors, with the question being, why were we sent to take this course? But again, all that really points out is that you're dealing with human beings in an organization, and sticking to your guns and realizing that some persons you have to assuage and make them comfortable, but for many people you have to excel so that their shortcomings will not slow you down. After leaving medical school, the other big thing is I did a stint at NIH for 2 years as a researcher. Again, researching from 7 in the morning until 6 at night, eating dinner, and working from 7 p.m. until 1 or 2 a.m. as an emergency room physician, maintaining 3 kids. I just loved it until I got sick and realized that I couldn't educate 3 children and maintain a family and be a clinical researcher. And that is what drove me into private practice. But one of the strengths in medicine is the role of the medical society. So the medical society, which I was first introduced to in St. Louis by Dr. Richard Ryder, who took me there as an intern and says, all of my residents will join the medical society as an intern, fresh out of medical school. And which taught me the strength of the camaraderie that the College of Medicine allows, even though it is surrounded by a large, unforgiving industry of medical care. And it's always looking at that college, and within that college, you will find camaraderie with fellow travelers. And there's great strength in numbers, even though the numbers might appear small as you aggregate a larger community around you. So it's really, and even when you are a fledgling member, showing up, looking around, speaking up, all of a sudden you find fellow travelers, and to give you that additional strength and understanding it takes to survive in this world. Kind of long-winded, but that's my story.
Thank you, Dr. Bone.
Yeah.
I love your positive, optimistic outlook and how you keep faith. And that's one of the ways that you are able to overcome things and see the positive side. Thank you. Dr. Kelly, now it's your turn.
So I'm gonna give 3 examples, but I think I'm very blessed, and I talk about Howard in such a positive light because I do feel like being in a situation where my race wasn't an issue really helped me to succeed through that. I always had a group of friends that was helpful, but I mean, from a financial standpoint, that still was always an issue. And as you know, a member of the Howard University Medical Alumni Association, we still are working to solve that through there, and we're seeing more people donate. But I chose to do National Service Corps. I wanted to do primary care, so they paid for 2 years of medical school and I got a stipend. So that did give a little bit of a reprieve within medical school so that I could focus. But as I said, when I got to residency, that I guess that bubble of Black excellence kind of kind of retreated a little bit because every year they only took 2 Black residents at Washington Hospital Center. And Washington Hospital Center, you can see Howard from there. So, you come into this program where you're again back in, I won't say backed against the wall, but I also had just had a baby. And I think the one thing that I found that when I came into that situation, I still did well as a resident, but I didn't do well on my in-services. So then that was always a conversation. Even though I was selected to be one of the chief residents, it was always, well, you may not know all the information, which was never a problem on rounds, but you're the leader. You can get people to do the things that you need to do. And I think a lot of us face that sometimes, is that they try to downplay that. And I think also what I found there was that foreign medical grads a lot of times come into the situation having already practiced medicine in another country. So the standard at which I'm being judged by is unfair. So I've not already practiced as a physician. My expectation of residency is that you're going to teach me and you're going to help me to get to that point where I can practice independently without the expectation I already know all of the information. So I found that was a difficulty in my particular residency program. And it was a challenge having a newborn and being on ICU rotation and doing overnight calls. And I remember specifically my resident, who was a woman of color, I was like, I need to go pump because I had been on call for 30 hours. And she was like, well, you have to finish this before you can go. And just the inconsideration of me as a woman and as a mother, that was something I tried very hard as a second and third year resident to correct and to really show concern for my residents who were going through those kind of things. So we actually had quite a few residents that ended up having children. And I think, we're talking about people of color, but as women and supporting women having families and supporting men having families, those things have to be taken in consideration as well. And the last example I give is one of the challenges, and it still is a financial one, is when I started my practice. So I had been working with another physician and I just didn't feel like I was being valued in that space and that my voice wasn't being heard on how I wanted my patients to be treated, how I wanted my atmosphere to feel. And so it was a very hard decision. I had just had another baby, I had 3 of them. And I decided I wanted to start my own practice. I tried every bank, they tell you, oh, you're a physician, you got all this potential, you got all of this earning power, you should be able to borrow money. I never was able to get a loan. Me and my husband took a loan out on our 401k. I worked 2 jobs. I worked at night while I started my practice and used my own money to do that because I wasn't able to find those resources through the banking community, which is a story that we hear about a lot of business owners in the Black community. There's not resources for us to borrow, or they don't see, they see our potential, but not really, right? They judging that we're not going to be successful in what we do. And the one other example I give is not mine, but the new dean of the College of Medicine at Howard, I really admire her because she tells a similar story to what some of us are saying. She did very well in medical school and she wanted to be a pediatric surgeon. She is the first board certified pediatric surgeon in the country, a Black woman. But none of the residency programs would take her because they said, well, nobody's done it, so why should we believe in you to do it? And I feel like that's kind of the challenge I faced in being a practitioner, like being a business owner, is why invest in you if you haven't done it? And I've had a great support system and people that are my cheerleaders and that are like, you can do this, we'll help you, we believe in your mission, and we'll help you make this happen. But how many people get the other side of that? Well, you can't do this is not possible for you, your potential isn't there. And the dean of the medical school came up with a novel surgery to do inter-abdominal chemotherapy in children, and she goes around the world and does that. If she had not been given the opportunity to be a pediatric surgeon, how many lives would not have been saved because of that? Her experiments and her research and the things that she has to add to the table. So I think that although like I said, I'm very blessed that I've been able to navigate in those ways and have people to support me. There's so many people who haven't and who haven't been supported in these options because people don't, they judge initially and say, you can't do this, nobody's done it. So I think we here tonight are breaking those glass ceilings and saying it can be done, we've made it, you can do it too, and then still reaching back to bring others up. I work with residents at Howard, I'm in their continuity clinic for 4 of them, and just continuing to give back into that space, having people come into my office to shadow, making sure that they can get the things they need and being a voice for physicians of all colors, but specifically Black physicians in the community, in our legislator, and being a leader in those different arenas.
Right. Thank you so much, Dr. Kelly. I want to echo those 2 things that you said that really resonated with me. We have to give back. We have to be leaders. We have to be those mentors for the next generation. And also, one of the things you said that, not many people talk about, oftentimes we go into residencies, and depending on where they are and what field they are, they may be dominated by people who are FMGs from other countries. And they have entirely different needs, challenges, and concerns than we do. But oftentimes they're, like you had, the majority of the residency program or a significant percentage. So that's an interesting statistic, that when we can't seem to get enough Black and other underrepresented minorities in medicine, but we can bring in people from other countries, that's sort of telling in a way. Okay, so now go on to the next question is about what challenges did you face as a physician and how did you navigate them?
Sure. I had similar experiences to Dr. Kelly. I never expected to have my own practice. I always thought I would work with other doctors, other ophthalmologists, and see my neighbors and things like that. I didn't really have a concept of insurance and how insurance it really is the decision maker in how you're able to gain patients and sometimes even treat patients. I worked as a LASIK physician, and I did enjoy that. But then I realized I missed treating the whole, I was going to say the whole patient, but rather the whole eye. The whole eye. And so I said I wanted to work back in my hometown, which is here in DC. And I worked at DC General for a while until it closed. And then I started doing locums work in private practices. And then it was like, hey, that's not going to work anymore. And you can say I wasn't asked to leave, but it just ended up like that. And so I started my practice, and like Dr. Kelly, it was difficult. I started my practice in 2005. So, and it was difficult to get loans. I had to work, and it was just hard to get a loan, but I did. And then I saw an opportunity in Southern Maryland, and they were looking to start an ophthalmology clinic there. And I already had my own practice. And I said, well, maybe I could work part-time at my own practice and part-time at this other practice in Southern Maryland. And I got that off the ground. It was very fulfilling. I enjoyed it. And then there, Southern Maryland, if people don't know, is very different from Prince George's County, Montgomery County. And again, I was asked to leave, not due to the way I was treating patients or anything like that, but who knows why, right? No specific reason. So I'm very grateful to have my own practice. I am everything from the surgeon to the janitor, to the mover, to everything. But I love it because I can treat the patients the way I want them to be treated. I can give them the best. I can listen to them, especially during times like this. Many of my patients are federal workers and they're nervous and scared. And not that I can necessarily help with that, but at least I can give them an ear, maybe give them referrals, refer them to other physicians that I know will help. The other thing, I'm not sure how much time we have, but I just want to say this. It is so important to be part of a community. And Dr. Sal, you mentioned MedChi, you mentioned the NMA, you mentioned the SNMA. And I will tell you, without all of those organizations, I would not be doing as well as I am now. And just as a personal note, you know, my mom has been sick and I'm not, I mean, I'm an ophthalmologist. She has other issues going on. And because I'm a member of MedChi, no matter what body system was wrong with her, I was able to pick up the phone and call doctors at MedChi and say, can you help me? And they did, of all races, colors, whatever. So you have to have a community, and organized medicine really does allow that. And you make friends across the country. And the other thing that Dr. Kelly said is gratitude. I never expect anything from anyone, but I am so grateful when people help me, and I try to let them know that.
And that's extremely important. I agree. And I'm glad that you mentioned that, Dr. Bovelle. Thank you. So Dr. Stallings, would you like to talk about issues or concerns that came up as a physician and how you navigated them?
I'm going to branch off a little bit, and I'll make it quick because I know, again, I know we're extending far beyond our time. But I also piggyback what Dr. Kelly said with something else, and that's not having physicians in our community. There was a friend of mine called, this is years ago. I've mentored quite a few students. This is one parent called me, their child could not get into medical school, Black kid. And I told them I wanted to meet with their child. So he applied, he got no interviews, nothing. So I met with him and I said, where'd you go to college? He went to University of Pittsburgh. I said, well, then what were your grades like? He said, well, I got a B. What do you mean? Okay, what were your other grades? A's. So he graduated from University of Pittsburgh with all A's and 1 B. Okay, then there must be a problem with the MCATs. What's the issue with your MCAT score? He finished in the 96th percentile. So he had an incredible resume, no interviews. So I told him, come talk to me. I'm going to interview you tomorrow. Come as you address, as you as you're going, you want to get interviewed for medical school. He came in some sliders, a pair of jeans, and a jacket. Just didn't know any better. So he didn't understand the process of actually going through medical school. I worked with this kid for 2 months. He applied to a bunch of medical schools and got into every single medical school that he applied to. And I say that if there are any listeners who are on the call who may have difficulty in navigating the process of getting into medical school, try to reach out to someone or even MedChi to find someone that can potentially help you navigate the process, because sometimes it's not grades or it's not your MCAT score. It's something else that you may not, something tangible that you can't put your hands on. So again, utilize MedChi as a resource for young people if they're on this call who are trying to get into medical school, because people who have done it may have a little bit more insight in how to do it.
Thank you, Dr. Stallings. Now, Dr. Bone, would you like to speak with us about the challenges as a physician and how you navigate them?
I real quick only want to be the provider of more time. 10 more minutes. The Q&A, I understand we want the Q&A, but you guys, the panel has been phenomenal, and everything everybody's said has been unbelievable. So I don't think the Q&A necessarily needs to be a part of this. We'll take questions via email, but continue your talk, and you guys have an extra at least 15 minutes.
All right, thank you. Dr.
You
Bone,
need it.
Dr.
You're on
Bone,
mute.
can you mute yourself?
That
Thank you.
an ongoing problem is recognizing that how societies change and yet how they remain the same. So Dr. Stallings mentioned dress, dress, attitude, presentation is a lot of what medicine is. Which brings to mind when I first got into practice, I requested to be mentored by a retired executive. So I was sitting in my office and he came in and he said, "Where's the doctor?" I said, "You're looking at him." He said, "Are you sure?" He says, "You don't look like a doctor." I didn't have on a white coat. I was too young. I was too clean shaven. I didn't present the image. So that wearing a white coat is of help. So that, and it's just knowing that that was then. Now the issue could be you can't show up for a professional interview in a baggy pants. And medicine doesn't allow cracks. So if your pants is not tied up around your waist, you'll have a different image. So that really the image you want to project is necessarily might be very different from the image you use to hang around your friends. And that is still true. So that even though you might be smart, you necessarily can't be yourself until you earn the right to be yourself. And so that does entail, it does entail a lot. And sometimes you can't see yourself in the mirror, and that's why having someone else help you with the overall importance of grooming in order to fit in, so that you can then deliver the care that you would like to deliver, because the package is important. And again, these are all solvable problems if you can see what a problem looks like. And quite often, the hardest part of a problem is recognizing the problem. And then being able to know that people love you and they are giving you advice so you can get through this difficult stage before you allow yourself to be yourself.
Well, I agree wholeheartedly that image is very important and presenting a polished look. One of the interesting things when I was starting medical school is quite a few studies came out demonstrating that unless you were wearing a white coat or a three-piece suit, if you were a person of color, you were assumed to be a nurse, a technician, or some other person in the hospital. So it was even difficult to practice as a resident, as a physician.
Mm-hmm.
And in these days where what we are wearing, all of us, are called hard pants and hard clothes. None of the younger generation wear them.
Yeah.
The last, when I went to the AMA meeting when it was in DC, half of the people were dressed in what I would consider loungewear or travel clothes. And it was only the older generation who was dressed in suits. But that somewhat sends an incorrect message to young people because it is expected. especially early in your career, you have to present yourself a certain way, anywhere from your pre-med discussions with your pre-med advisor to your medical school interviews, residency interviews, and beyond, because they can then see you as the face of their organization. Anyways, so thank you so much, Dr. Bone. Now, Dr. Kelly, could you please let us know some of your interesting experiences and how you've navigated them?
So I'm gonna talk about two of them. One of them is just mentorship in general and seeing myself and others as I've navigated as a physician. As I told you, it was a little easier in medical school and undergrad, and the last one is work-life balance. So from a mentorship program, I think the hardest part of what I did in starting my practice is that I didn't have anybody to help me work through that. My sister helped me start my practice. We researched, we went through, I asked people, I found a good lawyer that could help me to kind of get incorporated and kind of take those steps and how to get credentialed, and had to navigate that kind of alone. And I think the one thing that I did to kind of help others is when I started KCM Private Practice Solutions, I developed these modules that people can take as a course to help them start their practices. And even before I did that, I was helping other people start their practices and really pushing the importance of primary care. And especially because we know that Black physicians take better care of Black patients, right? So getting people of color involved in owning private practice and making it feel the way they want to also make people feel welcomed. That was a big part of what I wanted my practice to feel like, and I didn't feel like I could do that under somebody else's umbrella. So now I'm trying to help people to kind of see what that is. And we talked about how you look and those kind of things. And I don't wear a white coat very often. I have a black jacket that I wear. I wear tennis shoes every day. And I really have made my practice reflect me and who I am as a person. And people come and they wait and they complain a little bit, but I can only be myself. And I've really been very blessed to navigate a niche of that. A lot of my patients are very educated Black women, Hispanic patients, people of color. I really am big on taking all insurances. It's important to me to take Medicaid. And what I did past that was important to me to be involved in the community and be taking care of people that look like me. And that's why I do what I do with the county as a contractor for the homeless and making them feel like human beings as well and having adequate access and advocacy on their part and on the part of my patients that right now are really struggling. Like Dr. Bovelle said, many of our patients are federal workers. Many of my patients in the shelter are undocumented, and those fears and that anxiety that's going on right now is bolstering, my motivation to continue what I'm doing in that realm. But then that leads to the second part of the struggle is the work-life balance. How do you care for yourself and make sure you're healed and whole before you take care of others? And just a little bit about my story, I had gotten up to about 300 pounds, and I just felt like I was unwell because I was doing all this stuff for other people and not really taking care of myself. And also, I wasn't being a good example for my patients. I wasn't leading in a way of leading by example for them. And I really had to make some choices on how I navigate to make sure I'm healthy and whole. And it kind of leads to what the center is talking about doing too. Like, we have to take care of ourselves as physicians, especially Black physicians, especially women physicians, because our traumas are many. Like, we listening to everybody talk about what they've been through and what how they've navigated and the treacherous road that we've had to go through to get here. And we don't give ourselves some grace sometimes to heal from those traumas and to really, kind of find that mind space and really be a part of community outside of medicine. And so I really try to be intentional when I go home. I'm really busy all the time. When I go home, I sit with my kids. My son is autistic, so I let him, he asked me today when I was sitting there for lunch, he asked me a million questions about how many movies I saw, but it's important for me to be present for that because I won't get to have that conversation again with him. Making sure that me and my husband have a relationship because that's going to be important. Making sure that I have a friend group that supports me, making sure that I take time off. And I've been very liberal with my time off to a certain extent, but I feel like that's the way that I can decompress, and especially in our current kind of societal stress that's going on, we have to make sure that we as physicians are taking time for ourselves and healing ourselves. And it took me some time to be able to kind of look at that from a different perspective. And I think being at 300 pounds and feeling unwell and feeling like I was going to die in my body made me kind of be like, okay, I got to take a step back. I got to, I'm trying to also step back from certain things so I could, the things I really care about, I'm still a big part of, but taking a step back and really finding out what's important to me. Because, we aging every day by putting the stress of taking care of other people on our plate. And a lot of us, if we talk about this cycle of poverty, we're taking care of our family still. My mom, unfortunately, just passed away in October. But I was taking care of her. Me and my husband bought a house in Georgia for her. Like, we pay all the bills in the house, like those kind of things. So we're having problems making generational wealth because we're still taking care of lifting up those that we care about, because there's no foundation there already to help us on our journey. So I think those two things have really been big for me in trying to navigate, is make sure I'm providing mentorship, being a leader for my patients, and an example for my patients of taking care of themselves, and also finding my work-life balance and not getting to that stage of burnout.
Thank you so much, Dr. Kelly. The KCM Private Practice Solutions is a wonderful wealth of knowledge, and I think it'll help a lot of people. I also want to just mention one thing that you talked about, and how it's important to have African-American doctors for African-American patients. So in my public health career, what we were taught was, if you go to Africa and you provide a pill, a medication to a patient, they won't take it, because of the counterfeit that's so commonplace there, that unless you give it as an injection, they don't believe you're a real doctor. And then they're termed non-compliant when they come to the US and they don't follow. So understanding the culture is extremely important. And in medical school, we learned about when the spirit catches you and you fall down. It was required reading. It was about how in the Hmong community, which is in the Vietnam, Cambodia area, they believe epileptics are speakers of God. They're speaking in tongues. And so they don't treat epilepsy. And so there were court cases in California and in the West Coast, Oregon, and Washington to try to force patients of this culture to have their kids treated for epilepsy, when they thought these people were actually the instruments of God speaking, and they would not, under any circumstances, treat. So these kind of things are interesting, but there was very little time that I was ever taught anything about how important that is for the African American community, the Latin American community, and the Asian American community in the States. They were always sort of other things. The only thing that I ever once heard was, we come into University of Maryland at Baltimore, and in the ER and in some of the clinics, they'll hand you a script that costs $250 for your antibiotic, and the patients just walk out of there because it's something that happens so often. There's just not even a discussion. So patients, again, don't take the medicine because they couldn't possibly get the medicine, and then come back and are labeled non-compliant and get less appropriate care. So these types of things, and making sure that there's an understanding and that there are people who represent everybody in medicine, is important. And unlike in other fields, there is a specific need for it for the field itself to be successful. Of course, there's the greater good in other fields where, you should have everybody. But you really can't provide appropriate care all the time for everyone. There are just too many different kinds of people that, as individuals, we don't know about. And we don't often have the time to learn and to be able to provide that care. So I think it's incredibly important. All right. So our next question is about mentorship. Okay. So did you have a mentor or family member who made a significant impact on your journey? And again, we're going to start with Dr. Bovelle.
I've had several mentors who have helped, and to be brief, even today, I find that I have people that I can go to and ask. I don't want to say they're mentors, but they're guiders, and we help each other and we try to work things through. So it's nice to have colleagues to bounce something off. And I try to be a mentor to college students, pre-med students, residents as well. I thoroughly enjoy it, and I have seen them go on to medical school and fellowship and become practicing doctors, and it really lifts my heart.
So much. That's inspiring. Dr. Stallings, could you let us know about your mentors?
Yeah, so as kind of given my background, similar to Dr. Kelly, no, I didn't know any Black doctors, no Black lawyers. I don't think growing up I even knew anyone who had gone to college. My best friend had a similar demeanor to myself. He wanted to go to law school, and I went to college. You know, he was working hard, so by default I worked hard. And then after my second year, you know, that's when I kind of decided to go into medicine. But it was just the two of us, you know, it's just like a fairy tale story. The two of us kind of pushed each other, and you know, made sure that we both upheld our deal. And I mean, he's a very successful attorney in Atlanta. And again, it was the two of us together that pushed each other to make sure that we achieved our goals. But in turn, both of us individually make sure that we try to mentor those who come into our world to give back something that we couldn't receive when we were younger. Because it's important for young people to have that hope. And I received text messages randomly from various individuals. And sadly enough, I can't remember many of these people who send me text messages, but those who have gone on to medical school and, you know, have their own practices. And it gives me a good feeling that, you know, that I played a part in that. But it's particularly those who have not had someone to mentor. I think they owe it to, as you said earlier, Dr. Sal, you know, to pay it forward, that, you know, to help those who potentially need it, in particular because, you know, we never had that person in our lives.
Thank you. It's very important to have mentors and very important for us to pay it forward, as you said. Dr. Kelly, would you like to tell us about some of your mentors?
Sure. So the big two, I mean, I talked a lot about my mom. I think my mom was instrumental in me getting to where I am. I had the opportunity to speak at her funeral in October, and I think the one thing I wanted people to know is, like, even with my shortcomings with having a baby, with all those things, my mom always stood by my side, and again, never told me that I couldn't do it. And I tell people the story when I had decided that I was gonna start my own practice, I just remember feeling lost and being really upset. And I called my mom and she prayed with me. And, you know, she just told me it's gonna be all right. She was a person that's like, they just don't know your character. They just don't know the person that you are. They don't know your heart. And as soon as she prayed with me, everything just came together. It just went like it was supposed to. So I definitely, you know, miss her and but know that I wouldn't be where I am without her. And the other person is my husband. So we met, it's gonna be 27 years ago now. And being married, this will be our 20th wedding anniversary this year. And he's always supported me. He's always been there for me. He believes in me. He even when I'm on these kind of things late at night, he's there with the kids. You know, he allows me to be myself and allows me to thrive. And you know, for a long time he didn't want to just be Dr. Kelly's husband, but I think he's settling into that. And he's working on being a kept man now. So, you know, I think that you having those people in your life and that are rocks for you. They're not in medicine, but everything can't be medicine. Like one time he was just being really nice to me. And I was like, why are you being so nice to me? This is odd. He was like, I know you got stress at work. I don't want you to have stress at home. So having that village of people that really support me and believe in me is the reason I'm able to do the things that I do. And, you know, going back to my mom, I just think her faith and her way that she treated people, she wanted to make sure that if you came into her space and you needed something, that you got what you needed and you felt loved and heard. And that's really the type of practice and environment that I try to create, not just in my medical practice, but also with the mentorship that I do in the different organizations that I work with.
Thank you so much, Dr. Kelly. Dr. Bone, I'm sorry I skipped over you. The screens are moving around. And would you like, you're on mute again. Could you please unmute yourself and let us know about your mentors?
It was not a skip. You know, the one thing I wanted to allude to is as caregivers, the most important aspect of caregiving is the concept of the attending physician. And an attending physician pays attention. And as you pay attention, you actually see beyond, you see the patient as the patient presents itself, and you understand the patient in their particular situation. And that's what I try to aspire to. And that is what I think allows us to overcome many of our boundaries. But that's an aside. In terms of mentors, it all began with my high school teacher, Mr. Rudy Luck. Mr. Luck graduated law school at the age of 19 and decided not to be a lawyer. He was going to teach math. And he wore one pair of pants and never changed his pair of pants. And I would always be there for all of his students. And I just love geometry, and I love Mr. Luck. And he basically just allowed me to overcome myself, to escape being a statistic. And because he would always say, you don't have to be a fool at the back of the class, throwing spitballs wherever you want to do. And that actually helped me to go sit in the front of the class and pay attention. And then there was Dr. Bernard Hugenboom, taught chemistry. And he, again, stressed the importance of not over-excelling, but not underperforming. That fine balance between always having to be a super number one. And he reassured me being a solid number two is not a bad position. But you definitely shouldn't be a number three. And that kind of guidance has actually helped me throughout my life to, again, maintain that work-life balance so that you leave space for the other aspects of life. It's because we as people of color always feel that we have to compensate, overcompensate, double compensate just to make up for lack of, which is a trap. And because once you get in there, there's no end to overcompensation. So that's one thing that that I've always kept with me as a North Star, so that you don't get lost in performance. That's my story.
I think those are very important points about having these mentors, and also what you just said as well. I remember, there will always be times that we face difficulties, and there will be people who don't support us, but then there'll be those people who bring us up and help us, even if we didn't think of them as mentors at first.
Yes.
But they become people who are central in our lives and give us things that we can fall back on. Thank you. So our last question for the panel is, throughout your career, what changes have you seen in the diversity of medicine, and what gives you hope for the future? We're going to start with Dr. Bovelle.
Keep having these kind of programs. I'm seeing more and more of them. I think that it's really important for students to seek them out. And when you find someone who's willing to help you, listen and just listen. Don't think that you know it. Just take the time and listen and be appreciative of the time. And I'm just glad we're having more and more of these kind of programs. And I am seeing more of them, and hopefully they will continue.
Dr. Stallings.
Yeah, I'll make this brief. When I first started a million years ago, I was told by a number of Black physicians, don't go into radiology. You can't go into radiology because there are no Blacks in radiology, and you can't potentially have a practice or do whatever. As needless to say, I didn't listen to them. But when I first started in medicine, on the doing invasive procedures, I would go into a patient's room, and they would say, "No harm. I don't mean any disrespect, but I would rather have a white doctor." And you know, me being the pleasant guy that I am, knowing that I was the best one to do the procedures, I would gladly put someone else in there. And frequently, it was a horror show. And you know, they got what they deserved. I hate to put it that way. You wanted someone else, that's what you got. But I've seen a transformation recently in, at least in our area. I can't speak of other areas of the country, but now patients are requesting Black doctors. When I would go into a patient's room to see a patient, they would go, "Thank God it's a Black doctor." And it would just happen over and over and over again. And people embraced having someone that looked like them to take care of them. So that transformation in society is very hopeful. Even with my wife, when I met her, she was going to a white guy who was an OBGYN. One of my good friends, Susan Jenkins, was an OBGYN, and I sent her to Susan. She came home and she was angry. And she was angry because she said she couldn't believe that she spent all this time going to someone who really didn't care about her when she could have been going to someone who cares about her. And this happens. I've sent so many of my patients to so many different people, Black physicians, and it happens every single time. They're just so happy to have the ability to speak with someone that they have some cultural similarities to, and they feel more comfortable. And it's not that our counterparts aren't good physicians and don't take good care of patients, but the patient's comfort in speaking with someone who culturally is similar to them, I think, puts them at ease. So watching that transition occur through my career has been a wonderful thing to watch, and I hope that continues.
Thank you so much, Dr. Stallings. And Dr. Bone?
I would say that this is an excellent time to be a physician. And I would highly recommend everyone listening. I would highly recommend every high school student, every college student to consider medicine. And do not dismay that someone tells you it's $100,000 to go to medical school per year. It's just a number. Right now, there are more and more free medical schools, which would be unheard of 20 and 30 years ago. And I could see even more schools becoming free. Because at the end of the day, what we have to give is knowledge distribution and reducing the ignorance in the community. Healthcare is a right. And the miraculous thing that never ceases to amaze me is why African Americans get sick. We, and actually Americans in general, we are a select group of humanity. All of us came here either walking on a terrible ship or being chased out from where we were. We are a select group. All the people who could not stand being crowded, starved, beaten, talked bad about, they're dead. So that the fact that we're here means that we have been selected to survive. And money is not our problem. So all I can say is this is a great time to be a doctor. Rap at the door, shake the foundations, the doors will open. And what ties all five of us together is that we happen to shake the foundations when the foundations appear to be harder. And at any time, foundations and structures all appear firm and unshakable. But in actual fact, they're just as weak as a piece of paper in the wind. So that's my testimony.
Thank you, Dr. Vaughn. Very picturesque and very inspiring. Thank you. Dr. Kelly?
I think what's giving me hope is that the conversation is national now, right? Like we're not just having these conversations on the importance of Black doctors and Black patients, or we're seeing it in the media. We're seeing it in social media has it's been a blessing and a curse in certain ways. Like none of us like the Google Docs that are out there when they come in and see us as patients, but I think that we're able to be in TikToks and we're able to have Black doctors that are on a national stage and kind of be up front. And we're also seeing philanthropists and other people supporting medical schools that are fostering Black doctors. And like I said, I'm uniquely positioned as immediate past president for the Howard University Medical Alumni Association to see some of that in action and see how the Bloomberg grants and her name is blanking me, the Amazon wife, Bezos, how she came in and has offered, support of these initiatives and looking at how we can better serve our communities and access for everyone. So I think that's what's giving me hope is that no matter what the current climate is, it never ends well for the bully. It never ends well for the tyrant. History has shown us that, and we are at a time where we have to continue to fight. And I see the fight in people. So I'm hoping that continues and that, healthcare equity and like Dr. Bone said, healthcare is a right and that people will continue to stand up for that long term.
Thank you so much, Dr. Kelly. So now we've come to the end of our questions. I want to bring up a few points because I think there might be people who have concerns about the climate now and how that may impact us in terms of being able to support diversity, in terms of what may happen in medical schools. But I'd like to say one of the things is so far, in terms of diversity, one of the few fields out there where they haven't backed down from supporting diversity and these initiatives is medicine. Front page, AAMC, AMA, they all are continuing these initiatives, and they've all advocated incredibly well to all of our congresspersons that this is important in our field. So we still have this wonderful area where we can really bring up all of those URMs around us. I want to share in terms of my own changes that I've seen that are really positive. I come up from an Asian background, born in the States, raised when there were almost no people who looked like me around. And when I was growing up, I come from a mom and dad who have histories of doctors in the family. But let me tell you, when we moved to Maryland, all of the Asian people around said, "Why are you going into medicine? You're a woman." Nobody supported me other than my parents. People would come over to specifically say, "Can I speak to your daughter? Because really she should be getting married and having a kid, not worrying about a career. She's got her master's, just let her go and do this, and that's it." So it was tough. If I didn't have my community really of African-American friends, there wouldn't have been anyone who understood me. And and that is something that's changing. Now that there's so many more women and people of color in medicine, people won't have to struggle and try to find anybody who could help them and be their support in those times. That's one thing. We also haven't really touched upon it because I don't know all of your backgrounds, but I believe I'm probably the only Asian American. When I went into my medical school class, fully 1/6 of it was Asian American because it was part of a MD college combined program, and everyone from Rensselaer Polytechnic was Indian, of Indian descent. But they were absolutely unlike me because they all lived in areas or were directly from India. So the struggles that I faced are very different. So I always gravitated toward people because when I tried to talk about my struggles, it just wasn't understood. Most of my South Asian descent medical school compatriots, they had their parents come and fill their refrigerator every week with food. They came and did their laundry. It was very different. I didn't have any of that. I was married and I was essentially, I had a baby in medical school, but it was a very different situation. So that's one of the things I think it's really important for us to discuss things and have our bonds between all of us, because some of these things are the same. There are people I know who are from Africa who've come here and had kids, and their kids are also told, you're a woman, don't go into medicine. But we have a lot of similarities, and now we have a lot more people of color and in leadership positions all across the country. And so that should give us all hope. And like Dr. Bone said, don't let the challenges get you down. Go for it. This is a great time to be in medicine and a great time to be a person of color.
This is just the beginning. As everybody's mentioned, this is just the beginning of the conversation that the center will provide. I can't thank enough Dr. Bovelle, Dr. Bone, Dr. Stallings, Dr. Kelly, Dr. Sal for your moderation. Without this conversation, change doesn't happen. So thank you all. And this is, again, just the beginning of many conversations that we have regarding these topics. So thanks for everybody for joining. Thanks for everybody that's been watching. Hopefully this makes a change for students that are out there that are looking for guidance. Hopefully this makes a change for anybody, your colleagues, somebody that might do something with you at a hospital, something at a private practice. It doesn't necessarily know about your struggles or your obstacles or the things you've faced. I think that's the biggest part of what this conversation does, is understand the other side, the person that you respect, you admire, but don't necessarily know how they got there. So this is just, again, the beginning of a long journey that the center is going to be having in promoting mentorship and bridging that gap between these fine physicians that have shared their stories and students that might have questions or struggles. So can't thank you everybody enough. Looking forward to the next one already. So thank you.